good evening to us all, and you are welcome to Promise City TV Health Talk. My name is Abigail Kwe, and I'm your host. And today I'm also fortunate to have a talk with you on brain cancer. We are in the month of May and is designated as the awareness month for brain and nervous system cancers. And so I'm privileged today to have the opportunity to share with you what brain cancer is all about, the signs and symptoms, the treatment, amongst other information. In this month of May, last week was Mother's Day. Unfortunately, we couldn't have a session, so I'd like to take this opportunity to wish all mothers a happy Mother's Day. God richly bless you for all that you do for us mothers, and would be mothers too. We say congratulations to you in advance. So once again, this is Promise City TV and this is Health Talk. Before I go into today's discussion, I would like you to kindly help me share this program across to family and friends to join this session. I promise it's going to be an insightful one. This topic is rarely discussed, but it's very important for us to know. So kindly do that for me. And whilst we share the page, I would like to tell us a bit about Promise City TV and the program lineup for us to join whenever we have the opportunity to. So Promise City TV is a subsidiary of Promise Land Faith Ministries, whose CEO and General Overseer is no other person than Apostle Mrs. Bernice Agyemang-Prempeh. Mommy, I would like to say thank you very much for this opportunity to host Health Talk on this channel. It's a great honor and pleasure to be doing this. Promise Land Faith Ministries is privileged to have 3 branches, one located at Committee 1 behind the Gold Filling Station. Then there's also one at Dojum, that is New Dojum, and it's Dominion Temple. Then we have one in Ashiama, which is the Victory Temple. So if you happen to be in any of these areas on Sundays, you are welcome to join that fellowship there. So on Promise City TV, on Mondays is Bible studies at 7 p.m. Then from Mondays to Friday at 11 a.m. is Visitation Hour, which is hosted by Apostle Mrs. Bernice Agyemang-Prempeh. And every Wednesday at 7 p.m. is Exaltation Hour, with Irabi. And on Thursdays is Inspirational Hour with Pastor Jessica at 3 p.m. Then on Sundays we have the Health Talk Show at 4 p.m. with me. So for the ministry, on Wednesdays at 10 a.m. at the Faith Temple at Committee 1 is Faith Hour. And every Friday at 9 p.m. is Manifestation Half Night. You are always welcome to join the fellowship. On Sundays, you are blessed to have two services, one in the morning at the Faith Temple at 9 a.m. and then in the evening at 6:30 p.m. at Ashiama Atadeka at the Victory Temple. Okay, so let's dive right into our discussion for tonight. As I mentioned earlier, today we're going to be talking about brain and central nervous system cancers. My name is Abigail Kwe, your host, and I'm also a medical physicist. So I'm privileged to have this opportunity to share this information with you. When we talk about cancer, I believe most of us have heard about cancer, and it comes off as a death sentence, but I would like to say it is not. When we hear cancer, basically it is the abnormal growth of cells in the body. So it can happen to any part of the body. As I speak, there will be some pictures rolling on the screen, so you can pay attention to that as well. So if cancer is the abnormal growth of cells in any part of the body, it's right to say that when we talk about brain cancer or central nervous system cancer, then it's the abnormal growth of cells in that part of the body, that is the brain or the central nervous system. So you have the cells proliferating or growing abnormally more than it should grow. I mean, it's programmed to grow in a particular order, in a particular way, designed by God. But then you have the situation where the cells grow more than they should. Okay, so then we term it as cancer. There are 2 types of tumors or cancer. So we have the benign and then malignant. So when we say something is benign, or that what has been detected in your body is benign, it means it is non-cancerous. So not all tumors that are detected in our bodies are cancerous. They are sometimes benign or malignant. If it's malignant, then it is cancerous. So the treatment modalities administered is very different. Now, sticking to brain cancer, which is our focus for today, there are certain signs and symptoms that would indicate that one has or is developing brain cancer. Let me quickly talk about some of the statistics that we have in Ghana here. So for brain and nervous system cancers in 2022, it was responsible for about 2% of all cancer deaths in the country. So though it's rare, it is very real and it's happening. And so we need to really pay attention to it. Okay. So that's the statistics that we have as of 2022 in the country. So as we go into the common signs and symptoms, you would have persistent headaches. So when someone complains of persistent headaches, it's a sign that possibly the person is developing brain cancer. We've been talking so much about breast cancer, so please pardon me. Today's focus is on brain cancers. It could also be that the person is having seizures, could have a blurred vision. There's sometimes weakness or numbness, and sometimes there's also difficulty in speaking, and that's as a result of where the cancer is positioned in the body. I would love if we could have the pictures rolling on the screen so that we can refer to them and have pictorial view of what we are discussing today. So I've mentioned the persistent headaches. I've also mentioned the seizures. Okay, so on the screen we have the cancer. So you have on your left a normal cells growing in the brain, and then on the right hand side we see a growth which has been magnified for us. So there's a normal cell which transforms into a cancerous cell. So you have an abnormal growth within it, and it doubles or proliferates abnormally, not in the order of which it's supposed to grow. So basically this is how cancer goes in the body. So there are different types of brain tumors, if I should say, and it depends on the site it's located. So you could have a primary brain tumor or a secondary one. If we mentioned a primary one, that means the site where the cancer started is in the brain or the nervous system. Okay, and when it's secondary, it means that it started somewhere else in the body and spread to the brain. So when it's detected in the brain, but that is not the primary site it started, then it's termed as a secondary brain cancer. And you could have it in the optic nerve, you could have it in the medulla part of the brain. There's also a meningioma. Some may have heard of meningioma, some may have heard of optic glioma. So it all depends on the site where the cancer starts within the brain, and it's assigned that name. So here gives a pictorial view of the primary and then the secondary, as I mentioned earlier. Primary when it starts in the brain, and secondary when it starts somewhere else in the body and extends to the brain, which is what we see most of the time as well. So once someone has cancer and doesn't report early, it grows out of the region where it started or the organ which it started and spreads to other parts of the body. And in some cases, like the breast cancer, you could have it spread to the brain. Okay, it spreads to other parts of the body, including the brain. Now, when we talk about brain tumors, there are different grades. It starts gradually and spreads out. So when we mention the grade 1, it's starting, that is benign, so it's not yet cancerous. And this one has an excellent survival rate. Okay, so when reported early and is detected at the stage 1, then the chances of the person surviving is very high. Then we progress to stage 2, where the tumor is slowly growing and it moves to other parts of the body. It can move or invade other areas of the body. We have stage 3, where the cells are now fast growing, they are proliferating quickly, and it has become very invasive. When we say invasive, it becomes aggressive and is spreading almost everywhere. Okay, and then we have the grade 4, and that one is malignant, which I mentioned earlier as being cancerous. So it starts at benign, where it's not cancerous, and when not detected early to be treated, it keeps growing, proliferating, and spreading far from the primary site to other parts of the body, and that's when we term it as malignant. Now, let's focus on the signs and symptoms. I've mentioned the persistent headaches. One could also experience seizures. There's also blurred vision. In this case, it's affecting the nerves connected to the eye, connecting to your vision. So then the person begins to have blurred vision. There's also weakness. The person may experience weakness or numbness in their body. They could also experience difficulty in speech. Then that was supposed to mean that the cancer has affected the part of the brain that controls speech. And that is why the signs seen there is difficulty in speaking. There's also memory and personality changes. So a bit of memory loss, the person becomes a bit forgetful. Then it has affected the part of the brain that controls memory, okay? And then we have also loss of balance or coordination. And the brain has various functions and controls various parts of our movement, of our daily lives. So if there's loss of balance, that means that part of the brain has been affected, or that is where the cancer has started, okay? Now, I want us to take note. These signs and symptoms doesn't mean the person has brain cancer. They are signs and symptoms. Mr. Let's take note of this. Manimbo who say ebia unya persistent headache na say or cancer. Somewhere last year I had persistent headaches. I went to the hospital to have myself checked, and it was something else. So please don't assume these symptoms that I've touched on means someone has cancer, or don't be alarmed if you possibly having any of these symptoms. Your body is trying to tell you something, it's communicating something to you, that there's something wrong with me. And that's why we always advocate that when you're not feeling well, don't assume you know what's going on with you or you've experienced it before, so you self-medicate. Kindly go to the hospital or a clinic nearby and have yourself assessed, checked, talk to the physician. They will diagnose what it is and give you the right medications. Okay, so please don't assume persistent headaches alone means that you have brain cancer developing or someone has brain cancer. Let's not scare ourselves. It's important we have this knowledge and work towards that. Okay. Now, someone who is at risk of having brain cancer, I need to be careful. It's brain cancer, not breast cancer. So who is at risk? Everyone is at risk. Everyone is at risk of developing brain cancer. It could be an adult, it could be a child. Now, cancer doesn't look at age or gender. It's abnormal cell growth. So adults have their cells dividing, growing every day. Children also have their cells growing and dividing every day. So it could happen to anyone at all. It's not gender-based or age. No, that's not what happens. It can happen to anyone. And that is why we are having this discussion. So some of the risk factors. So we don't have causes or causating factors, but risk factors. What shows the probability that someone can have brain cancer or cancer. So cancer doesn't really have a cause. In the case of brain cancer, there's no particular cause that this will lead to that. No, we call them risk factors. Okay, so one key thing there is family history. There's also the previous exposure to radiation. So probably a person has had, in some cases, exposure during treatment to radiotherapy. Then there's a reoccurrence in the place where the person develops brain cancer. Then there's also genetic conditions. It could be as a result of genetics. So if it's in the family, it runs through and the person could develop brain cancer. So as I said, in most cases, it's not a cause, but a risk factor. So that increases the person's chance. That is not to say if someone has had brain cancer in the family before, automatically you're going to also have brain cancer. No, that is not the case. That's not what we are saying. And that's not what happens, okay? There are some people who have had it, they are interrogated, and there's nothing like that in their family. There are some people who also develop it, they are interrogated, and it has happened in the family before. So we can't call it a cause, but then a risk factor. So now, how is brain cancer diagnosed? Please, if you have any questions or comments, you can put it in the chat and I'll gladly read it out or attempt to answer it for you. So we've now looked at the symptoms, what brain cancer is, we've seen the symptoms. Now let's look at the treatment. Someone is now, we look at the diagnosis first. So you have the symptoms, you go to the hospital, you've seen the physician. What are some of the tests that are done to determine that this is really brain cancer? So the medical history is taken. As I mentioned, it could be in the family, so we need that information. We also have neurological examination that is being done. We have some tests, imaging tests that we do, and that is my area when it comes to scans, imaging. So we have the CT scan. Most people say scan, scan, scan. There are different types of scans, okay? There's ultrasound scan, there's CT scan, which is the computed tomography. There's also MRI scan. It's using magnetic, so a magnet. That's the magnetic resonance imaging. There are so many scans. So in this case, we use the CT scan or the MRI, the magnetic resonance imaging. And based on the results or what is being seen. So when the doctor looks at you physically like this, he can't tell. And if he suspects, based on the information you have provided the doctor and suspects it's brain cancer, they will have to send you to take these scans, imaging scans, and it will prove to them that, okay, the person really has, the lesion is located here, and it will inform them as to how to treat you. In some cases too, we do what we call biopsy. So we go into the brain where we are suspecting, or based on the image scans that we've had, go into that part of the brain, pick the tissues, and it's sent to the lab to be tested. Remember, it's the abnormal cell growth. So the cells are picked, the tissue is picked, the cells are tested, and there we can confirm whether the cells are benign or malignant, and the right treatment is administered to the person. So the person has gone in to see the doctor. All these tests have been done. It's now confirmed that, unfortunately, the person has brain or central nervous system cancer. What are some of the treatment modalities that goes on? So the case is brought before what we call a multidisciplinary board. So it's not just the decision of the doctor. It's a whole team, medical team, that sits down and discusses the case. That this person has presented with this and that, it's been noted on this part of the body, located here, this is the size and all. What are the possible treatments? So there's surgery, there are three main modalities. There's surgery, there's chemotherapy, and there's radiotherapy. So surgery is to take out the tumor, the mass tumor. Chemotherapy is administration of drugs, like you go in for a drip, a drip or IV, no. But these are specialized drugs that goes to attack the cancer cells in your body and kills them. So that's what we call chemotherapy. Then we have radiotherapy, which is also my field. Radiation therapy. So it's the use of radiation to treat the cancerous cells. It's targeted to that area and hits them and kills the cells. So on the screen now you have the treatment methods, the chemotherapy, the radiation therapy, and then the CED. So radiation therapy is the use of a machine that produces rays, X-rays, high energy X-rays, targeted at that particular area of the body, and it kills the cells there. Then the chemotherapy too is also to administer drugs, specialized drugs, to attack the fast-growing cells in the body. So those are the main treatment modalities that we have. And as a physicist, my major role is ensuring that the imaging equipment is working optimally and safe to use by the staff, which is the radiographer, and on the patient and the public, people around too are safe. Then when it comes to after the images have been taken, we put it into a system which we call the treatment planning system, where we plan the treatment after the deliberations with the multidisciplinary team, and it has been agreed that this person needs radiotherapy. So in some cases, people go for surgery before they come for radiotherapy. Some also do chemo and surgery. Some do chemo and radiotherapy. So it varies. It varies. Depending on what we are seeing, the team decides what treatment best works for you. Okay. And then you are informed for your consent before we proceed with whatever treatment will be administered to you. And so I always advise patients or people who go to the hospital, whatever is happening to you, please communicate it effectively and understand whatever the clinician tells you will be done, will be your treatment that will be administered to you. If you don't understand, please ask for clarification and understand it perfectly. Okay? Please ask for clarification. They will do their possible best to explain everything to you so that you can understand. I've had somewhere last week, I was working at a CT scan center, and a patient came in to be scanned. She was so scared. She kept standing up from the couch. She can't do it again. She's scared. The machine will pull her in. And we asked her, why do you think the machine will pull you in and it will kill you? Apparently, she's been seeing some videos rolling on TV that the machine just drew the person in and killed the person. Please, most of the videos out there are not true. Yes, we may have had incidents, especially with the MRI, because it's a magnet. We don't allow ferrous or magnetic substances into the room. There are checks and balances put in place to ensure that. We've had accidents and incidents where a wheelchair has been drawn into the ball of the machine. But a lot has gone on. There's been a lot of advancement and development. So safety measures have been put in place. So we explained it to her that she's safe. The machine is not going to kill her or draw her in, because we need the images for the doctor to determine what exactly is wrong with her and give her the right treatment, administer the right treatment to her. So please, let's be careful of the information going on out there, which is why we have this program and many other programs to educate us with the right and relevant information. So please, if you haven't liked or shared this link or video for people to join, please do so right now so they can get the right information. Okay, so the scanner doesn't kill. It helps us to see into you, know what is going on, and helps the clinicians give the right treatment. Okay, so let us not be scared. Whenever you go in and understand anything, please talk to the health professional who is attending to you and ask your questions. Please and please again, ask your questions to understand. Okay, don't assume and take everything on social media as it is. No, let's not do that to ourselves. And as we are also educating ourselves here, let's also send out the information and educate others about it. Okay, so the images are taken. We plan the treatment for the treatment. The radiotherapy treatment plan is done by us. It's approved together with the doctors. So there are doctors who are specialized in this field to treat, and they are called radiation oncologists. So medical physicists together with them, together with the radiographers or therapy radiographers, so they administer the treatment on the radiotherapy machine. We work together with them and the treatment is delivered. And so you are in safe hands whenever you go to the clinic. And once again, I also like to send this caution and advice as when we go to the hospitals, we find ourselves sitting together with other patients discussing, Dr. Nick has said me way and I did that and it helped me and I'm doing this, somebody said this. Please, two people could have the same diagnosis, the same prognosis, but their treatments may be different. You remember I mentioned a team sits on the case and decides what will be best treatment for the patient. So you don't go discussing and telling oh, I did this, I did that, they told me mine is this, and you want to follow what a patient went through. Please, it doesn't happen that way. Treatments are individualized, so we take you as one person and treat you solely. There are treatment techniques, treatment regimens that have been given, protocols that we follow. So if it's a brain cancer, there are protocols we follow, but we treat each patient individually. So please don't go about sharing information across like that and take it on and use it, oh, why am I not responding to it? Or this person is responding and I'm not responding. We are different human beings. Even if you look at our fingerprints, we are unique. So someone may respond differently, another person will also respond differently to the same treatment, same diagnosis, same treatment being administered, but our body responds differently. Okay, so please let us be aware of that. Let me see if I have any questions in the chat or in the comments to address. Okay, there's nothing like that, so I move on to some of the common myths and misconceptions that we have. So it's about the headache, which I've also addressed, that every headache is possibly leading to brain cancer or the person has a brain cancer. Please, no, that is not the case. There are signs and symptoms. Okay, there are signs and symptoms. So that's not to say with a headache, persistent headache, then the person has brain cancer. No. And then about radiotherapy, cancer is not curable. Cancer is very curable. The situation we have in the country, which I've seen whilst in the clinic, is that most people present late. I run us through the various grades, grade 1, grade 2, up to grade 4. We have people presenting late. They sit with the symptoms until the disease has progressed wide or spread before they come in. So there's little that the hospital can do to help the person. Some come in so late that all we do is give them palliative care. When we say palliative care, we just manage pain until the person dies. And we don't want that. We want to see most of us doing so well. So if you have any sign or symptom, not just on cancers, but if your body is communicating something to you, please don't sit at home. Yes, mentine and treat you and a new doctor, Mr. Bomodia co hospital, yen show. Nay, who adequate poten how, near mouth the right treatment. Even if it happens that it's something that has occurred before and you are given the same drugs, please follow what the doctor is saying or the pharmacist has prescribed and has given to you. Please, let's follow it. Don't go about saying, oh, some time back, as I am a biome, so this third time, I'm going to treat it myself. I'll go for the same medications. No. Well, there are some drugs that you can't go to the pharmacy and buy it. You need a prescription to buy. So they may not give you some drugs, but some are over the counter. And please, we've talked about self-medication. It is not good. So go in and have yourself checked to be given the right treatment that would help you. Okay, so let us not delay. And when you go in and start treatment, we've seen this case most of the times in the clinic. People start treatment and they stop because waba you started treating no pain no cough no whole no into now we jai. Please, when treatment is not over, don't stop. Most people stop, they go back to their normal lives and activities, and the cancer, the treatment is not over. Breaky treatment, what say BBI? When you come back, we have to start all over again. We've had so many instances. I can't talk about it here. So many instances, people stop their treatment, they interrupt their treatment, go home, go about their lives, and come back when the pain has started again. And usually when you come, we have to take you through the entire process, because what's the first treatment na and cancer, we don't treat cancer that way. You have to start everything again. If it's radiotherapy, you have to do calculations of your treatment, your prescription, everything again. Reassess you and assess the extent of what is happening in your body. Inti mesre, say call for treatment, and now you be call for treatment. Let's encourage them, and please let's support them. They need the support. Cancer is not a death sentence. It is not. It's very curable, especially when detected early and treated early. So we are advocating for early diagnosis and early treatment. Some people have it diagnosed early, but they delay with the treatment. Yes, we know sometimes it's financial issues, and so if you can't support, you're always calling on for support. If you can't support anyone, if you don't know anyone you are ready to support, you can walk into any of the treatment centers and offer your donations or anything to them to support any patient. Korle Bu Teaching Hospital, Komfo Anokye Teaching Hospital, and we also have Sweden Ghana Medical Center. All these centers treat cancers. I know of IMA also giving chemotherapy. So you can walk in and donate to them to support patients. If you know someone too and can offer words of encouragement to, please, let's do so. Let's not neglect them. It's not contagious. Inti wo ben nipa kro na enye se be sign wo there be. Cancer and sign nipa sa. And sign nipa sa. Inti mesre, let's provide as much support as we can for people who have cancer or they are living with cancer. Let's not stigmatize them. Let us help them. They need that care and support. I mean, hearing the news alone of having cancer is very traumatizing. And to have friends and family neglect you because of this, I see that it even kills them faster than the disease. So please, let's not neglect them, but give them the maximum support that they need. So there are, to be wrapping up, I would say that there are advanced technologies to treat cancer. So don't sit at home. Don't kill yourself early. Please seek for the right medical care. Seek for the right information, and you're going to be cured, if I should put it that way, hopefully. If it's detected early and treated early, you would have the cure for it. So please don't rely on self-medication, as we keep saying, or herbal remedies is one challenge too that we've been facing. People stop the hospital treatment and they go and come back. Oh, when you ask them, oh, okoye bibi dro, mesremo, bra, real treatment no. We are not akwa we bibi dro no so. Ye besre. Mayem mixe no. And now feel say no never want ne we jaho. And most of the time they come back. Obekwa say na waba. Mpempi dodo na obetwa omo treatment no so hospital ho. No mo akwa omo kosom kotoa omo kwa koye bibi dro. Ombeba no na asay. It looks as if we are not able to cure them, or the hospitals are not doing well. Please, our doctors, our nurses, physicians, everyone in the hospital, they are doing their possible best. My emma omwejuma no enye din. Yes, repi. My emma omwejuma ni enye din. Yen bwana ejuma ni enye ye. Let's spread this information. May hasn't ended. It's the month of brain or central nervous system cancer awareness. So the little that you've heard here, kindly go out there, share with others. Let's encourage people that is not a death sentence. Cancer is not a death sentence. It is curable when detected early and also treated early. So I would say thank you once again for joining me on the Health Talk show. And today we have been talking about brain cancer and central nervous system cancers. I believe you have learnt a lot today and also shared the link with others so that they can join in and listen. I mean, the video will also be available for you to listen later if you've missed out on most parts of what we've discussed today. So quick notes: early detection, hope and treatment advances are available. Please seek for clarification whenever you go for medical care. Seek clarifications. And let's spread the news wide. Okay, so thank you all so much for joining me today. It's been a pleasure hosting and also being the guest speaker for today to share this relevant knowledge with us all. I hope you are always available to join us every Sunday at 4 p.m. on Health Talk on this channel, and it will sure be a blessing to you. Your health is your wealth, and so we need to take very good care of ourselves. Before I go, let me quickly appreciate our sponsors for this channel. So we have Abba Partners, and they are also the sponsors of the Your Salvation Is Now Crusade, which is organized by Promised Land Faith Ministries. If you like to be a partner, you can also call the numbers on your screen and be a partner of the Abba Partners and be a sponsor as well. Then we also have Ben Benny. They are into the they can assist you with your travel documentations. If you need a passport, if you need assistance with traveling outside the country, they are there to consult and provide the right advice and information that you need to do that. We also have Lightest Media, and they are branding of souvenirs, calendars, whatever you need, media, photography, videography. You can call them and reach out to them, and they would assist you. We also have Hemco Enterprise, and they provide us with our water to nourish us every time on the program for all our programs. We also have Rope Automations. They are located at Ajin Kotoku Amasaman. They are into batch plants, industry machines. You can call them and they'll assist you if you need any of these services. We also have Prissy Logistics if it has to do with export or import, freight management, door-to-door services. They are located at Tema Community 5. You can call them and they would assist you. We also have Decovas Enterprise. She's into decor. She's located at Tema Community 2 opposite the Community 2 post office. So if it's birthday parties, weddings, any event at all that you need decor or you need gifts being wrapped neatly and nicely for you, you can call them and they will have that done for you. Last but not the least, we also have Crash Makeovers. They do makeup, hair, wig revamping. If you need a new wig, they can get that done for you. And also have the heart and the time for kids to do their hair. So if you have kids and need their hair done professionally for you, taking good care of your kids, please visit them. They are located at Tema Community 1. Okay, so all too soon our time is up and we'll have to wrap up. Let me see if we have any questions in the chat before I go. Okay, I don't think I have any questions here. No. Okay. Sorry, let me check comments. So someone's asking if brain cancer can be treated well in Ghana. Yes, I mentioned, so we have 3 treatment centers. We have one in Kolebu teaching hospital, one in Konfanochi teaching hospital, and then a private center located at Lakeside City Adenta. That is Sweden Ghana Medical Center. And let me add this, that some people, if you are privileged, let me not say privileged, but if you've happened to have someone or know someone who had cancer, may require advanced imaging like the PET, that's positron emission tomography. Mostly you have to book outside the country and go in for, which is very costly. But fortunately, we have one in the country now. It's located at the Sweden Ghana Medical Center. So you don't need to now travel outside the country again to access this modality, imaging modality. It is right here in this country. It was commissioned last Wednesday by the President, His Excellency John Dramani Mahama, and so it's available in the country. So cancer is treatable very well in this country. You don't have to travel outside. We even have foreigners coming in to be treated here. So please, it's very treatable. And there's a question to that: can you inherit brain cancer? I mentioned one of the risk factors being family history and then genetics. So there's that chance, there's that possibility. It's not inherited, but if it's in the family, then one's chances. So if a person A, person B, if A has had someone in their family with brain cancer, the person A's chances of developing brain cancer is higher than B, who doesn't have it in their family. But that's not to mean that person B can't have brain cancer. Just that the chances are lower for B than A because of family history, okay? Eating some types of food, no, doesn't cause brain cancer. We have risk factors, not cause factors, risk factors. So there are certain things that increases one's chance of having brain cancer, not causes, please. So there's no particular cause that this will lead to brain cancer. No, that's not the case. Late night eating doesn't cause brain cancer. It doesn't. And eating canned foods too, please, it doesn't cause brain cancer. It doesn't cause brain cancer. I mentioned risk factors. So let me quickly run us through the risk factors again, just for those who weren't here. You can go back and listen to the whole thing. So I mentioned that it can affect both adults, children. It doesn't matter gender, it doesn't matter age. It can affect anyone. And the risk factors for this type of cancer includes family history. It includes being previously exposed to radiation. Okay, any form of radiation. So around this area and you are exposed to radiation, there's a likelihood, it increases your chances of developing brain cancer. And there are some genetic conditions as well. Okay, so it is not, and there's no exact cause known for this. They are only risk factors. Okay, they are only risk factors. I hope I've addressed your concerns very well. Smoking cigarettes too can't cause, as I mentioned, risk factors, not causing factors. They are risk factors. Okay, they are risk factors. What I know for smoking and we decide smoking cigarettes or weed. Okay, smoking cigarettes or weed. What I know is the smoke going into our lungs. That one has a higher risk of developing lung cancer because the smoke goes through your respiratory system, and the smoke contains carcinogens. So there are substances that can induce cancer. That's what we call carcinogens. So in that case, this increases someone's chances of developing lung cancer, but not for brain cancer. Okay, and there are other cancers too. This smoking is also a risk factor for breast cancer as well. Okay, so but not for brain cancer. Okay, I believe I've addressed every concern here for now. So we'll call it a day here, and it's been a pleasure hosting you today on the Health Talk on Promise City TV. My name is Abigail Quay, and we'll call it a day for now until same time next week. Please stay healthy, take good care of yourself, do not self-medicate. Visit the nearest hospital available near you and have yourself checked. And again, persistent headache alone doesn't mean someone has brain cancer. Please go and have yourself checked. Your health is your wealth. See you same time next week, Sunday at 4 p.m. for another exciting discussion on your Health Talk show. Take care. Bye for now.
Many swadium it was soon smooth film. Men who japa eja. Eja ni si wanim say. The Jan is si wanim no sika bi ekuta wonsam bi ato janim. Why ya so bedum janu ntumi num nya no. Te many swadium was soon smooth film. Say sika pa beton se. Na wa mom pai so obedi de kasa eka bi twa ho hia. Eka. Na ma hwe ena mem. Me so obi te ho. Nipa no ho adwene ba ne tima na afrim. Nipa no ni Ghana wa brochire. Nipa no wa brocho ni Ghana. Ho adwene si ne tima na ho adwene firi tim. Obi wa brocho pese opoa wo. E wo sunsumo wiase ade amene hwene ni. Bo ma mpa ebu mu anya dia. Ona no be hye ogu ebosa na ebo na ba kokra we bebem. Amen.
Bon se merade. Bon se
Ba kokra we bebem. Ba kokra we bebem. No man sa mo mpa ya ade bi adon sa be somso bi aso ntim fa nkwa wiye.
Bon se merade. Bon se enoso eye no kwepa.
Last year no kam person mu ni go ya ne yare fo. Ti last year yare ampa ni tuso. O yare pa. Na nke o se wo wu nyame na je no.
Bon se merade.
Ya 2 arrow of stroke. 90 me am for one to form. Yes, I bet 2 second one. Second one at the water form. Me who say what jojo. Ya 2 we na enya but to me am for one to form. Me who say asa to foforo. Na nke ya to bof. But this time they 2 yen there. Me say do to form but ene oni Yesu ahia ene arrow no erade ye free. Last year obrepa wenya ni easy oni peduam o yare pa. Sika woni nsema ni timu nya dio. Sika woni nsema ni timu nya dio. Na uko free fear ema doso ya na be ye doso. Sana ni fie tie.
Bon se merade. Bon se eye no kwepa e ma doso pa.
It's a Sade on any new mamma program.
Se eno de omona oni no wo problem.
But this time in Kanjo say womb what it. Nyame memo de ade bia brem na ma kire wa de bi na waye. Wo ho kire wo do na ho ha kakra. Aho kire gu so too much. Enipa bia do me do too so much go be disappointed.
Eno kwepa. I'm confident.
Omom do too so much go be disappointed. It's when this wadi mo sunsumu fam. E to de bi kwaya na kapere kwaya na bi no.
Se eno kwepa.
But when this time in Kanjo there is a restoration. Oh, there is a restoration. Oh, there is a restoration. I say there is what? A restoration. Yeah, and found them what dear man and for phone. Stop. You see there? Jai, stop it. Stop. Obi associate dear for stop. Jai. Yami ama ufe baby on. So no now for 4 baby. Any pa yana yata approaching ya. And when I wouldn't botayewu, it was here you use that same beauty to destroy that purpose. you use that same beauty to destroy that purpose. That favor is for a purpose. It's for a purpose. Now me person me count birthday moon some channel. How you spend your birthday. Sika was spending baby I will call you. What means when I'm for you na yomude? Cause any baby I was a son idea. Say na tadie. Say an impabua. Or dear son. I dear one a brabo. You can't saboma. A radentena idea man. I did be a rush work hospital. I will market him to you smudge trim. Be the smudge trim. Month of March. Be the smudge trim. I will be a yacht woman if you. At a day midwife at a day soon we are see a year through. Yea, a through. At a day be I will be say on my one say that idea no. must not come into reality as a midwife. Let that arrow go back. I did be a more church. Our market. Now month of March. And I did any womb. Now dear April. I don't run into me. You see, I did April. I didn't do it because I did me can be see a day March. Into I did be any monyam be a channel of what April goes shabarata. Into I did me came a idea of Serrano Pa. Equi. As will be a was an own fellow fine. As will be an way okay. There was a one fellow fine say, I am maybe. I say, when you're cold, I say, you are not okay. But the whole man said, why Frank I cry? All my say, within you, no, I say you are not okay. Now say, son, oh yeah, what kind of orchestration in Frerate?